Good day, nursing students. I am Ate Jen, and I was invited to give you a short talk about my experience as an oncology nurse. I've been working at Philippine General Hospital for 3.5 years. It has 1,500 bed capacity and different units. Fortunately, I am selected to work at Cancer Institute. In total, I've been working as an oncology nurse for 3 years. I am also a member of Philippine Oncology Nursing Association or PONA. Cancer Institute is a special unit. What makes it really special for me is that it is like a small hospital placed in a big hospital. In our department, we have our own admin office. We also have different clinics for outpatients. We have our own machine for x-ray and CT scans. And we also have chemotherapy clinic or the activity center. After ng patient na makita ng doctor nila sa outpatient clinics, they would go to ambulatory chemotherapy center para doon i-chemo. Kasi sometimes, yung mga chemo lang ng patient would run up to 2 to 4 hours. And after that, we will monitor them for 30 minutes to 1 hour and they are good to go. For those patients na mas matagal sa 1 day yung chemotherapy nila, they are admitted to Cancer Institute ward. Sometimes kasi yung chemotherapy nila would last for 1 to 3 days. That's why they have to be admitted and we have 39 bed capacity for them. There are 18 bed capacity for medical oncology patients. These are patients na may lung, colon, nasopharyngeal, breast, and other cancers sa other parts of the system. And they would undergo chemotherapy or sometimes blood transfusion. And we have 2 beds for surgical oncology patient. Ito naman yung mga patients that would undergo surgery, but they are also cancer patients. We also have 1 bed for hospice oncology patient. Sila yung mga patients that are terminally ill or kailangan ng mga end-of-life care or support. We also have 4 beds for gynae oncology patients. Sila naman yung mga patients that have cervical cancer or ovarian cancer and other female reproductive system na may cancer. And also, we have 4 bed capacity for the adult hema patients. Sila yung mga patients that have leukemia, different types of leukemia. We also have 1 bed allotted for patients who are admitted for blood transfusion only. And we have 5 beds for pediatric patients. They are cancer patients under 18 years old. And lastly, we have 1 bed for patients who will undergo radioactive iodine therapy. It is also part in Cancer Institute yung mga brachytherapy or radiation therapy ng patient. We also have our own pharmacy separated from the main pharmacy. It has a specialized equipment needed for the pharmacist to mix different kinds of chemotherapy drugs to avoid exposure and also inhalation of the substance. For our usual setup, there are different nurses assigned in each clinic and also nursing attendants assisting them. Sa ward naman, we have 3 shifts. So, may AM, PM, and night shift. There are nurses, nursing attendants, physicians, ward clerk, nursing aides or the administrative aides, pharmacist, medtech, and radtech. That's why it is a whole unit or department. First, we will admit the patient, and then we will send the chemotherapy protocol to the pharmacy. Once na may order na ng doctor, we will instruct the pharmacy to mix the chemotherapy drugs. And once na may dispensa nila, we will hook it to the patient. Nakamix lang siya sa IV fluids. So, i-hook nyo lang siya sa IV line ng patient. And sometimes, yung mga chemotherapy drugs ay sensitive sa light, so we use chemotherapy cover to protect them. And also, we have to always wear gloves because toxic po yung chemotherapy drugs and it can enter yung mga pores natin. We will also become familiar sa mga chemotherapy drugs na names like 5-fluorouracil, doxorubicin, etoposide, bleomycin, and many more. In one cycle, may mga chemotherapy drugs na magkakasunod na binibigay. For example, yung Folfox na regimen. Meron siyang oxaliplatin, folinic acid, 5-fluorouracil na IV bolus, and 5-fluorouracil na IV drip. So, as a nurse, what are our responsibilities? First, we have to check the doctor's order, and also we have to counter-check yung chemotherapy drugs na na-dispense ng pharmacy. It is really a must to check the label and as well as counter-check yung name ng patient, name of the chemotherapy drug, and the dosage of the drugs to be given. We should also wear correct PPEs, especially gloves, because we all know that chemotherapy drugs are toxic agents. And also, we should be cautious and aware of the chemotherapy spills. We have right PPE for that because we have to prevent na ma-inhale natin or tayo mismo ma-expose ng mga chemotherapy drugs. Proper disposal of chemotherapy drugs is also a must. We should also monitor the vital signs of the patient before, during, or after chemotherapy. We should also report any adverse drug reactions to the physician or doctor immediately. We also encounter challenges sa ward, especially when it comes to nurse-patient ratio, because we all know that there are only few nurses practicing here in the Philippines. That's why there are lots of patients or yung bulk ng patients sobrang dami, especially when it comes to cancer patients undergoing chemotherapy. So yung mga patients na to, we have to monitor them all. Kapag sabay-sabay yung chemotherapy ng patients, sobrang hirap i-monitor lahat. Kulang yung 8 hours to do the task. For instance, in my case, I have 10 patients undergoing chemotherapy session at the same time. So, I have to give them pre-medications. Ito yung binibigay 30 minutes prior chemotherapy or before chemotherapy so that it would lessen the side effects of the patients like nausea and vomiting, loss of appetite, and also other adverse drug reactions. And after that, we have to monitor the vital signs of the patient before, during, and after chemotherapy. And yung mas mahirap dito is kapag may nag-react. Like, sa mga cases ko, may mga patients na may allergic reactions sa chemotherapy. That's why yung iba nahihirapan huminga, we have to intubate them or give them anti-allergic medications. Despite of all the challenges that I've been through as an oncology nurse, I could say that I am really happy with my workplace right now. Especially kapag magpapasalamat yung mga pasyente namin for taking care of them. I hope you find oncology nursing as an interesting subject because you'll never know, one day you'll become an oncology nurse.